Rubber bands for braces, what are they? How are they used? And how do they work? Hi, welcome to Braces Guide. My name is Dr. Dave. I'm a board certified orthodontist and we're going to be talking about rubber bands today. So let's talk about the most common types of rubber bands. The rubber bands that we use are based on the kind of bite that you have. So the purpose of the rubber bands is to try to improve your bite. The braces and the wires, they correct the alignment, the straightening of your teeth, and then the rubber bands will help to improve the front to back positioning of your bite. So for example, if your bite is a class 2 malocclusion, which is commonly referred to as an overbite, orthodontists will call this an overjet. The class 2 malocclusion, the lower teeth are behind the upper teeth, and then the rubber bands that are connected will help to improve that front to back positioning by pulling the lower teeth forward and the upper teeth back. So those are called class 2 rubber bands. A class 3 malocclusion is where the lower teeth are in front of the upper teeth, sometimes referred to as an underbite. And the way this works is that the rubber bands are connected from the upper molars down to the lower canines. In that case, the rubber bands are helping to pull the lower teeth back and the upper teeth forward until you get that front to back bite change that we're looking for. So class 1 elastics are used in a class 1 type of a bite. That's where the front to back bite position is about where we want it. We don't need to change that front to back positioning. And they're commonly used to help close spaces within an arch, for example. There's other reasons why we use those rubber bands. They're probably not used as much as the other type of rubber bands though. We also have vertical rubber bands. So vertical rubber bands are used to help pull the top and bottom teeth together. Sometimes if you have, for example, a canine or a tooth that's up too high, we're trying to help bring that down and get it into a better position. We can use rubber bands to help pull those together. Another type of rubber band is something called a cross elastic. A cross elastic can be worn in the back or in the front. And the cross elastic is designed primarily to help correct a crossbite. If an upper molar is too far in, we can use the rubber band to help pull that out or pull the lower teeth in. One very important note about rubber bands is that sometimes they're made from latex, which if you have a latex allergy, you want to be sure to tell your orthodontist. There are latex-free versions available, non-latex rubber bands available that you can use in that case. Sometimes patients can develop an allergy over time. So if you didn't have an allergy to begin with, but you notice some irritation on your cheek or on your tongue when you're wearing the rubber bands, you'll want to make sure you tell your orthodontist. So how long should you wear your rubber bands? You really want to make sure you follow the directions of your orthodontist. Your orthodontist knows exactly what kind of movement that they're trying to achieve. So if they're trying to improve your overbite, you may need to be wearing these rubber bands all day and all night. So 20 hours a day, for example. But other times, you might only need to be wearing them at night. But it's very important that you follow the directions very closely because if you wear them too much or not enough, that can cause problems. It could prolong your treatment time, or you could also overcorrect your bite correction. So there's two important components to think about with rubber bands: the force and the duration, so the length of time that the force is on the teeth. I have a video, I'll put a link up here, on how teeth move, but in this case what we're trying to move is your entire bite, so we're trying to change a lot of teeth. And so it's not going to be something that's very obvious in a very short amount of time. It's going to take longer before you're going to start to see those changes. Because again, the amount of teeth that you're trying to move is much more significant. We're not just moving one tooth, we're moving a whole group of teeth on top and on the bottom. So how are the rubber bands attached? Well, it's pretty easy. You can use your fingers. You just reach in, hook it around the back. For example, if you're using a class 2 rubber band, hook it around the back and your orthodontist will show you exactly where to connect it, and then back up to the canine. And then now you have that rubber band attached in a class 2 direction. Another option for placing rubber bands is to use a tool. What's nice about this is you don't have to reach in as much, and right now we're all trying to keep our hands and everything really clean, so this is just a nice way to give yourself a little bit distance between reaching in with your fingers. So this tool is really handy. You just connect the rubber band to the little hook end and then you can use the tool to reach in and then hook it around where you're supposed to go. So this tool, a lot of orthodontists will provide these, so you just need to ask your orthodontist if they have these. If not, I do have a link below where you can purchase them from Amazon. So some really important things to think about with rubber bands. First, you want to make sure you follow your orthodontist instructions. I can't emphasize that enough. Orthodontic treatment, it's a team effort, so we need your help. You know, the braces are put on, the teeth straighten, everything is aligning, but we also want to improve the way that your teeth are fitting together. And the only way to do that really, in many cases, is to use rubber bands. So it's a team effort, the orthodontist and the patient. The length of time is super critical. So if your orthodontist is recommending that you wear the rubber bands all the time, 20 hours a day, 7 days a week, it's really best that you do that. And the reason is that if you wear it less than that, it's really going to slow down the treatment time. So you want to make sure you have the proper size and the thickness of the rubber band. So just confirm that again with your orthodontist if you run out. If you're purchasing some on your own or if you're borrowing some, it may not be the right size and it may not be the right strength for your specific situation. Now this one might be obvious, but it's very important that you wear them on the correct teeth. You don't want to be wearing them backwards or in the wrong side or in the wrong direction. Also, it's best not to double up on the rubber bands. I see this from time to time on patients, but the problem with that is that if the force is too high, sometimes that can slow down tooth movement. Again, if you're doubling them up and you're wearing them only at night, during the day when you're not wearing them, the teeth will move back and you're not really making the kind of progress that you're hoping to. Hopefully the video was helpful in explaining a little bit better on what the rubber bands are all about. Go ahead and hit the like button if you liked the video and subscribe if you'd like to get notifications for future videos. Also, if you want to just put in a comment and let me know if you have some specific topics that you'd like me to discuss in future videos. Thanks again for watching, and I will see you in the next video.